that, I would like to introduce our coach of our team to the lineup, Steve Bullock. Thank you, Governor.
Thanks, Eric. Thank all of you. And I'm not sure how the overall lineup works. I got to duck back into another meeting in about probably 15 minutes, but really appreciate everybody joining in. Also the opportunity to hopefully answer a couple questions. So I won't talk too long.
Great.
When, Eric noted 37 days ago in Big Sky, we declared an emergency actually before our first case. When COVID-19 first came to Montana, we took aggressive measures to slow the spread, keep Montanans home during a critical period. What that did in many respects, we bought time for healthcare workers and our first responders on the front lines. We've kept our hospitals, especially in our rural areas, from becoming overwhelmed, and worked really to protect our most vulnerable populations and remove as many people from that overall chain of transmission as possible. And we really have been flattening the curve, which really does, at the end of the day, save lives. Because we acted early, and we acted early with input from public health and emergency response experts. We are in a good place in as much as we have a much lower rate of infection per capita than almost every state in the country now. We've been able to keep our cases relatively low because we know what's best for our state and because we care about our neighbors, and these efforts have not been for nothing. Together, we're not only saving lives, but we're making sure that we're going to be able to reopen our economy, get it thriving again long before many states really could by any metrics. And I know that this has been difficult. I mean, Montanans are hurting financially, and we all want to get Montanans working again. So we're taking steps to get there. For well over a week now, and that's what the meeting I got to get back into. We've been working with public health experts, business leaders, and others to determine how we can start opening our state back up while keeping people safe, avoiding a new outbreak or becoming the next hotspot or region. Last week, I also announced the creation of the Coronavirus Relief Task Force to help sustain Montanans through the pandemic, to help put our state on a path toward economic recovery. Montana will receive $1.25 billion to respond to the crisis. And the way that the language of the law and the CARES Act was passed is it more or less says you can use this money for additional costs, state and local, that are brought about by COVID-19, not using any backfilling of lost revenues. And a little frustrating as much as we still haven't gotten any guidance from Treasury. We're just harping on that with a call with the Vice President today, because we're supposed to have gotten it by last Friday at the latest. But what the task force is really doing is it's examining sectors of the economy to understand the impacts of COVID-19 on Montanans, consider the unique needs of each region of the state, provide guidance on best how to utilize these funds. That's working with businesses, workers, tribal communities, nonprofits, state and local governments, with an eye toward both the immediate pain and also long-term recovery. Yeah. Now, more than just sort of how to spend money from the federal government, that's where we're working on how Montanans can be earning and spending their own money. The Adjutant General has been leading a process based on military strategic principles to look at how, when and how our state can safely reopen. And it's had folks from public health, emergency response, local providers, business, industry leaders. Stay-at-home directives in effect through this Friday, April 24th. Shortly thereafter, we'll move forward with phased reopening. And later this week, probably by Wednesday, we'll present to Montanans what that plan looks like. We've got to recognize that this is still will be a gradual process, because once we begin to reopen, first, that doesn't mean that all social distancing, all of this is gone and we don't have to worry about it anymore. But once we begin to reopen, we want to be able to stay open, and our new normal is going to look a lot different, and because the virus isn't going to go away, and we're going to have to continue to adapt to how we're going to live with it for the next while. In addition, sort of this plan for reopening, it's going to have some planning in the event we face setbacks. So a phased reopening, several factors were taken into consideration. Some of them are metrics that President Trump laid out himself last Thursday for states. Some of them are going to be unique to Montana. We have to have a sustained reduction of new cases for at least 14 days. We have now gotten there. And we got there just over this weekend. And really, again, that's thanks to the work of Montanans in every corner of this state and adhering to social distancing measures. Second, we have to make sure that our hospitals are able to safely treat all patients, both COVID-19 and with other conditions, especially in our rural areas. And third, we have to make sure we have the capacity to test all people with COVID-19 symptoms, and then the capacity for our state and local public health officials to conduct active monitoring of newly confirmed cases and their contacts. While our state labs have been able to sufficiently perform testing, we still need to ramp up our testing capacity further. Still at times we're having shortages of swabs and reagents, impacts that capacity to test on the ground. We're working on it, but as every governor tell you, we have to make sure, or we need the federal government to be working with us, not competing against us. And I'll continue to voice those issues and concerns along the way. And every single day we're working on getting supplies. Finally, I think we have to reopen in a way that actually works for businesses, public health, community, and main streets. We want to do it so that they have time to plan for what a reopening looks like and are prepared. And there's some guidelines coming from the state on that side. Again, I want to open up things as much as any single Montanan, and that's why we've undertaken this process. But we have to do it responsibly and in phases, because it's not any gross exaggeration to suggest that the minute we start reopening, we are going to get additional transmission of cases. And how we deal with that is going to dictate whether we're taking 3 steps forward and then 5 steps back. And we'll do it in a way that both protects Montanans' lives and the recovery of our economy. And we'll do it our way, which is based on the data and the science along the way, not the politics. I know that this crisis is hurting Montanans. I also know, though, if we get it wrong, it'll hurt us even more. As Eric spoke about sort of your community, the greater community on this call and others, in times of crisis, Montanans have always pulled together, and that's how we have slowed the spread, protected our doctors and nurses, and saved lives. And we need to keep working together, keep taking care of our neighbors, and doing what's best for Montanans. So I'll stop there and could answer any questions, or try to come back later.
We'll be quick, and if you're able to join us again, that'd be great. You just tell us when you got to leave. We'll just bust through a couple questions here and make good use of your time.
Sounds great.
Do you think we'll be sitting in a rodeo stand with a beer this summer?
When this summer?
July or August, when, in all those Dillon, areas, or even here in Big Sky or around the state, concerts, farmers markets, rodeos.
Yeah, I sure hope so. I sure hope so. But that's also, to be honest, as we do a phased reopening, it depends on how that works, and assuming that it's working, and then assuming that we have the tracing and testing capability for where hotspots break out. In July and August, absolutely so.
Yep.
And that's everything that, not unlike the federal level, we'll talk about the phases, but it's sort of the actions. One of the challenges, like, people want to look at this in 2-week chunks.
Yep.
What happens today at Big Sky, we won't know for 2 weeks.
Right.
So when we start opening up things, to think we'll have a real keen sense of what's happened exactly 2 weeks from there just is medically false. But I want to do everything we can to make sure that we could do that. But then also recognizing that the rodeos may look a little bit different. That we are still going to have, until a vaccine or until this thing goes away, we're going to have some social distancing standards that we continue to adhere to.
Absolutely. Today, with Maryland reporting that they went ahead and bought 500,000 tests from South Korea, they kind of put they took their destiny under their own control. Is that something that, What do you think about that? Is that something that you'd consider? And obviously some of our cities, even like Big Sky, are small enough to where it's reasonable to think that we could test everybody here in a reasonable fashion if the test existed.
Yeah, and Governor Hogan, the governor of Maryland's been when I was National Governor Association chair, he was vice chair. Now he's chair. No, we are looking at every single way that we can get additional supplies for testing. At a bare minimum, right now, anybody that has symptoms should be getting tested. And there's also some real concern with asymptomatic transmission, people that may be able to actually transmit this even though they don't show symptoms. But that's part of what we're looking at all the time, is how can we further expand test capacity, not only with the tests being run at the state lab, but also talking to healthcare providers all over saying, what is your machinery? What would your capacity to test in a non-supply constrained world? The challenge is still that there's significant supply constraints. So yeah, we're getting stuff outside of the supply chain, not unlike the governor of Maryland did.
So kind of a closed basin testing per se for some of the small cities around Montana, be something that the state would consider?
Well, I think first what we'd probably have to do, Eric, is look at, are we doing all the testing we need to do in high risk areas? And the high risk areas are certainly nursing homes, any places with vulnerable populations, the potential for more sentinel surveillance, trying to test everyone in some of our tribal areas as well. So I don't know if we'll get to the point where everybody in a non-supply constrained world, I would like to see every Montanan tested.
Sure.
But there is no state yet that has been able to get to the point where we're not dealing with supply constraints.
Absolutely. What's something that keeps you awake right now?
Everything.
All right.
I mean, look, from the perspective of every one of these directives that I put in along the way, like when we said statewide school closure, I know that there are kids that are less safe as a result. I know that there are businesses struggling and saying, when can our nation get back to a normal, and what's that normal going to look like? So this is nothing that I don't think is, 37 days ago, that not how I thought I would spend the past 45 days by any means. But
excellent.
Now that we've gotten our hands around it, at least for this moment, and now that we can actually see some light at the end of the tunnel, I mean, keeping people from getting sick and dying have been part of what has kept me up for the last 45 nights. And the next 45 is making sure we don't get into that position where we're spiking.
Excellent. Well, you tell us when you have to go, Governor. I'll let Joe grab a couple questions from the audience so we make sure we get their voice into this. And you just
why don't I take two more questions, then I'll go back in the other room.
Okay.
You got it. Thanks, Governor Bullock, for joining us. Joe O'Connor here, DBS. You issued a directive last month allowing all counties to issue absentee ballots to all voters for the June 2nd primary. Have you discussed November absentee ballots? And if social distancing measures are still in effect, would you push for absentee ballots in the general election?
Yes. So Joe, I haven't yet, meaning that under the directive, we said it's up to counties. Counties can make the decisions of whether or not they are going to do mail ballot, yet you still have to be able to, if you don't mail it in, there still has to be access to actually get and vote at the clerk and recorders. And was pleased that all the counties came together and said, yeah, this is the safest way to do this. I hope by November that we're in a different discussion and, this isn't even an issue. So it's sort of that I'm looking at trying to figure out how we can make sure to have our rodeos open in July before I start thinking about the mail ballot elections or the elections in November.
Understood. Gotcha. This one comes from Kevin. You discussed, Governor, testing for COVID-19, and a lot of current literature is stating that widespread testing and monitoring is our best route forward until a vaccine is developed or herd immunity exists. Assuming that testing becomes available and affordable, would you support a pilot project that entails widespread testing and monitoring if such a program existed in a place like Big Sky, for example, so our community could welcome visitors again safely?
Well, absolutely, to a degree. Now, let me tell you what that means. First of all, the widespread testing and monitoring. So right now, anytime, and that's local public health is working on that anytime that there is any positive, they're doing contact tracing, going all the way back to say, who all were you in contact with? I think the idea that you could test a Big Sky, everybody in Big Sky, and then Big Sky would be safe. That's contingent on who's coming to Big Sky on a regular basis beyond that population you tested as well. I'd love to see more testing, pushing for more testing all the time. Mm-hmm. And it's just whether we're in a supply constrained environment. As an example, we got 15 of these great rapid test machines from Abbott Labs that can actually process. It's a point of place test where you can find out in 5 minutes whether somebody's positive or not. And it was great to get those 15 machines, but in total, I think we've received 40 testing kits, individual kits for each of those machines. So until we can get more test kits, those machines might as well be doorstops. They're not, it's not sufficient in as much as, and it's something that every governor uniformly has been talking both to private industry and the federal government about making sure that we have not just the capacity to do the tests, but then the actual equipment, the swabs, the reagents. It said that, what I had heard from around the state is, well, we might be able to test more, but we don't have the viral swabs to do so. Finally got about 5,000 more of those this morning. We'll be pushing them out all across the state. What I want to do is make it so that there aren't excuses or barriers to, at the end of the day, hopefully being able to test more and more. And at some time, communities all the way along.
Yeah, I mean, it's crazy. There's a shortage. I mean, what is your read on why there is that shortage nationwide?
Nobody was really planning for a global pandemic. I mean, to tell you the truth, I mean, look at even if I get PPE for healthcare facilities, that I'm going outside of traditional supply chains because demand significantly exceeds the supplies that we have. And the same is with testing capability. Now, there's great innovation occurring all across the country and the world in saying, how can we develop new tests and how can we ramp up production? But the demand is so much more significant than the supply. And the good and bad, for some respects, of us managing this well, in as much as that our infections aren't, COVID-19 positives per capita aren't as high as many states, is that it makes it that much harder for us to get the supplies. Now, I could also see somebody on the call saying, well, wait a minute, maybe your supplies are low, or your COVID-19 positives are low just because you aren't testing enough. Well, we're about middle of the pack right now in testing per capita. But even if we weren't testing enough, our hospitalizations would be a heck of a lot higher. So we look at all those metrics when we're trying to epidemiologically say, what is the level of contagion in Montana? It's not just the number of tests performed or positives of those tests.